Hi, Dr. Berg here. I realized the last webinar that I did is about an hour long, so some of you might not watch it. So I wanted to create a quick summary of the webinar that I just did. Okay, so we talked about stress, and that's the first thing we want to talk about. So stress activates a hormone called cortisol. Cortisol would be considered like liquid stress. So what it does is it basically creates adaptations to your body, so your body can adapt to stress. So it affects the muscle, the bone, the brain, the kidneys, the blood sugars. So if you're being chased by a tiger, you're going to actually run on sugar, so you're going to spike your sugar. So chronic stress leads to diabetes because of that effect. It's going to create mental focus, acuity, because you know you're being chased by a tiger, you're going to be mentally acute. But you don't want that when you're sleeping, when you're thinking about stress all day long. And then over time, when cortisol goes higher, the little receptors that receive cortisol in the different parts of the body, they start to become resistive because too much cortisol is very, very damaging to the brain, for memory, and you name it. And then so the effects becomes less and less and less. So you have this high amount of cortisol, but no benefits from the cortisol. So you get belly fat, but you get inflammation because the adrenals, the cortisol is an anti-inflammatory, and that's why they give you cortisol or steroids or prednisone for inflammatory conditions, because you run out even despite your blood tests being normal or high. See how that works? So someone's talking but no one's listening. The same exact thing happens with the pancreas. When it pumps out insulin, the liver receptors become very resistant. They call it insulin resistance. That's type 2 diabetes. So they give you drugs, metformin and glucophage, which is the same thing, that makes that receptor dilate, get bigger, so the insulin works now. But why don't you just cut down the sugar? That would do the same thing, or better. So really what happens with chronic stress is it can affect a lot of different things. Autoimmune stuff. All autoimmune problems occur after an injury. If you ask anyone, when did it start, what happened just before, there'll be a loss of a loved one, a divorce, a stress, an injury, you name it, it's a stress event. Okay? Autoimmune. What is the only treatment for autoimmune? Prednisone. What is prednisone? Cortisol. It's all the same thing. So cortisol is very destructive to your immune system, to your bones, collagen, your blood sugars, your proteins of your leg, your belly fat, your minerals, your memory, sleep apnea, high cholesterol, high blood pressure, allergies, asthma, all these conditions. That's a cortisol, that's a stress effect. So in medicine, what they're doing is they're taking the disease and treating them separately. They're not looking at the foundational underlying cause of all these symptoms. These are symptoms, these are stress effects. So they're side effects of stress. And then I also talked about what to do. There's several things that you can do. From a nutrient standpoint, the number one nutrient for stress would be vitamin B1. But you have to be careful because most of it's synthetic, so you want to get a natural B1. I'm going to be coming out with an Adrenal Day formula which has a natural B1 in a couple of weeks, but in the meantime I would recommend getting nutritional yeast. Take a heaping teaspoon in some yogurt every single day. That will help with stress, especially mental stress, because stress depletes B1. So does sugar, so does refined carbohydrates. We talked about the best exercise for stress would be walking. Why? Because you increase oxygen and you get your attention going out versus trying to, all day long, we're trying to counter stress. We need a lot of oxygen, low stress. Walking is the absolute best thing. Okay? And then I also talked about the number one place on your body that holds most of the stress would be right up here in the atlas. It's the first cervical vertebra. And there's a technique. When you download the manual, I gave you a link down there. We show you, you can use a tool or you can use your hands. If you go all the way down, I give you links on the videos. So if you go to that link, I think it's Dr. Berg Massage Tool Manual, or in massage-tool manual. I give you videos on how to do it with the tool or without. But I created this tool for my own body since I have practitioners, but usually I'm the guy that's fixing everyone, and so I'm the last guy to get any help with my body. So I developed this. This is my best friend because I can lay back on my couch and hit these points and just pull the stress right out within 2 minutes. So right back here, if there's any practitioners watching or doctors, it's called the parasympathetic, the heart of the vagus nerve and the raphe nuclei. But if anyone else, just forget what I just said. All that means is that this is the turn-off switch to help you go to sleep at night. And you lay back on the couch, melt the stress, and I show you 7 other places in the manual that you can download of how to use this on the different places in your body to pull stress out every night. And then I showed everyone how to do a technique, how to get rid of like right shoulder pain, left shoulder pain, low back pain, plantar fasciitis in a very unique way. Okay, so you'll like that. All right, so you can download that stuff. And then the last thing that I suggested, if you don't have this tool and you want to get it, I gave you a coupon code to get 10% off. And then plus, if you get it and then write a review on Amazon, an unbiased review, I don't really care if it's whatever it is, I'm going to send you as a nice little thank you my advanced acupressure do-it-yourself program with all the techniques. It's 4 hours. It has manuals on each. And we'll send you a link because I'll see your review and I'll actually capture your name and send you that link. Normally it's $495 on my website. You can have it for free because I'm trying to get reviews on Amazon. All right, so that's only good to the end of the year. All right, so I hope you enjoy the summary. Click the link down below and start applying these techniques on your body. All right, that's the summary.